Panelists. So my name is Michael Krausz. I'm the UBC Leadership Chair for Addiction Research, and we have the pleasure to welcome here with us in her absolutely busy schedule in Ottawa. Jenny Kwan is since I think a few periods. Is it 2015? You are in a member of Parliament for Vancouver East, and she is really one of the very atypical politicians, really engaged and really supportive and warm-hearted towards the population she is caring for so much, and she knows a lot about vulnerable urban populations, more than probably most of us. The next speaker to make ladies first is, sorry, Roberto, is Raha Masoudi. Raha has a promising future, I guarantee that, but she has not so much experience. Raha is about to study medicine at some point soon, I guess, and she is right now working in a study together with Martha Ignatievsky on fentanyl use, and she is also a very outspoken person, so that's the reason we thought she is the best potential person. Also to lower the age range, right? I'm not counting, so but it's a good level. So, and Roberto Sassi is a colleague and friend coming from Brazil, and he is for a year now the head of child and adolescent psychiatry in BC Children's Hospital. So it's kind of core area of work. Okay, did I miss anything we want to throw in right from the beginning? I don't want to offend anybody. No. Okay. I don't want to misrepresent you. Yeah, the topic we choose is around this really concerning mortality rate and the increase of mortality among adolescents and young adults. If you look at young adults in the current coroner statistics in BC, but also other parts of North America, you see a 10-time increase in the age group of 19 to 29. It's very, in terms of fatalities, we don't know the numbers of survived overdoses, but I guess that is going hand in hand. And we wanted to really invite you to discuss solutions, really what could be done to stop that, because actually, child mortality is always an indicator for healthcare systems. It was always, but adolescent and young adult mortality is also a very important indicator for the quality of healthcare in general, I would say. So I have some questions for you, but I think it's also absolutely okay if you kind of give a 3-4 minute statement in the beginning about your perspective, and then we can dive into Q&A and interactive discussions. Is that fine with you? Yeah. Who would like to go first? Nobody? Come on.
I certainly can if
yes,
if you'd like for me to just sort of open the discussion.
Yes, it's fine.
Okay. All right. Well, thank you very much for that very kind introduction, and congratulations to all of you, and thank you to all the volunteers and the people who've actually put this conversation together. I think it is actually one of the most pressing issues of our time, in the sense of the loss of people. As you've indicated, the mortality rates is it is just absolutely devastating to learn of people dying, what I would say are preventable deaths. And yet we continue down on this path of not doing what is necessary to prevent the loss of life. I think particularly if we're talking about it in the context of youth or young adults as well, what we're seeing or what we're not seeing, I would say, is their active involvement in the decision-making process about their own care. I think there needs to be more of that engagement. We know that on a lot of the issues, for people to be part of the plan, in moving forward, their engagement is actually much more likely to be successful, and is much more likely that they will engage in the process. And yet, when we're talking about this issue, we don't have a lot of that. So I think it is absolutely critical that we have those opportunities for self-determination and active participation in that regard. And the truth is, if you look at our communities, there aren't a whole lot of youth-led, youth-specific services either. And that too, I think, needs to be part of the solution. We need to make sure how to bring young people's voice to the table and for us to talk about what those solutions might look like. Experiences, lived experiences, the narrative of storytelling projects, for example, might be one way to engage young people in the complexity of substance use issues. I think that we need to accept the fact that abstinence often is the only thing that's sort of advanced. And what we do know, abstinence only drug education is not realistic and often ineffective. We have to come to accept that. And then you can move forward to say, what can we do? What else can we do? What needs to be done? I'm not saying that abstinence should not be an option. It can be an option, but it cannot be the only option. And then it has to be through the determination of the young people's lens, and then therefore a plan that can be developed in connection with them. I will also just touch on a couple of other things. When we talk about substance use, there are many other intersectional issues related to it as well. Mental health is a major piece, and we know that resource is just simply inadequate and not available to support mental health challenges for people, even diagnosis at an early age, and to ensure that the necessary support is in place to help them navigate through that challenge. I would also say that for a lot of youth and young adults, housing is critical as well. So really, a lot of the issues around the social determinants of health is tied into this, and we have to look at the substance use issue as a clear health issue and tie these other pieces together if we're to have success and hope to have success in addressing the crisis that's before us. I will pause here. There's much more, of course, that I could say, but these are just sort of opening remarks that I think we can bring together to initiate our conversation.
Thanks a lot. Raha, you want to go next?
Sure. I guess I'm just going to introduce myself, and I'll save my remarks and thoughts for the questions. But yes, hello, everyone. My name is Raha. I'm a recent graduate from UBC, and I've been a research assistant under Michael's supervision for a few years now. I've been working with youth for a few years through different roles. I have been a crisis responder with Kids Help Phone, nearing 3 years on that this year. And I've also volunteered as a peer supporter at UBC with AMS Peer Support. And currently I'm also the coordinator for a website called walkalong.ca. That's an online educational platform targeted towards youth wellness and recovery. So I guess my contextualization on this panel is to offer my insight and what I've learned through working with youth. And as Michael mentioned as well, I'm currently working at Vancouver General Hospital as a research coordinator with Martha Ignashevsky, and we're kind of investigating the topics of fentanyl, mental health, and healthcare system innovation. Before I entered that role, I was also working in the field in the downtown east side as a research coordinator, and I guess that was what kind of sparked my interest in pursuing a more meaningful role in this field of research. So yeah, thank you so much to everyone on this organizing committee for having me on the panel, and feel very grateful to be here.
Okay, Roberto, you want to?
Yes, I just wanted to echo the words from Ms. Kwan, which I think go to the core of the things that we need to address. I mean, we know that any intervention to reduce mortality has to start by listening to the people that we wanted to address. And this has been proven over and over again, not only with interventions to reduce mortality after overdoses for a toxic and illicit drug supply, but also for things that are related to suicide. There's plenty of evidence out there that the interventions that were created using the ideas and concepts provided by youth, families, caregivers have proven over and over again that they are able to reduce mortality. And so many examples, I mean, might sound relatively simplistic, but they are not. What young people wanted to see is that we go beyond the medical model, that this is a crisis that has to take into account educational issues, trauma, culturally sensitive approaches, has to look at housing, has to look at things that go much more broadly in the society than just considering this a medical issue that has to be dealt by a particular medical intervention and particular medication. So we know that the programs that have taken that into account have a better evidence in providing a difference in people's lives. We hear when we go and ask young people about what kind of services they wanted to be offered to them, they clearly say that it has to be low barrier, it has to be available promptly, has to be integrated. And this is something that we have to provide. We cannot expect that young people and their families are going to be experts in navigating a complex system provided by a variety of different providers, and they're siloed from one another. So this is on us to provide this level of integration, not on the families, not for us to expect on the families to do that navigation. And it has to be done promptly at the time of the highest risk. As you mentioned, Michael, there is still a large number of people that are not being connected to evidence-based treatment, even after the highest risk moment in their lives, which is surviving an overdose. And there's evidence, you might be familiar with the study from Massachusetts that looked at the outreach cities in Massachusetts, in the state, that provided outreach to people that survived an opioid overdose, and cities that did this later or did not provide this. And the difference is dramatic in terms of survival rates, and as well as support for housing and employment and income and so on. This is data primarily from older adults, but I think that this can be applicable for young people as well. If we don't provide outreach, if we don't go there and offer prompt services that are culturally safe, that are co-designed by youth, that are integrative and holistic, and go beyond just the substance use, we're going to miss an opportunity of engaging people and the highest risk time, and they might be falling through the cracks and be putting their lives at risk again.
Mm-hmm. My question would be then, do you think that the current situation and this threat of an overdose has an impact on youth and on adolescents? And what should be our message to them? Because the numbers I mentioned in the beginning with this very kind of not really accessible or not existing care is worrisome, but I'm pretty sure that this current situation is also perceived by students, by high school students or whatever, and they discussing those things. Am I correct, Raha?
You're definitely correct, Michael. To sort of touch on your question, I think that the most important thing that we can do is to work to build positive relationships with young people. This is true as parents, healthcare providers, peers, and political figures. So when kids feel listened to and understood, and they're able to reach out in times of difficulty to adults that care about them, they will ask more questions, provide more trust, and are more likely to listen to the guidance that's being provided to them. So to send targeted messages to youth, these are future generations of voters, and I think that they're currently under-recognized as being such an important group to focus on and engage with. By doing this, we can build youth activism, and great examples of this we are seeing in the US and in Canada around things like LGBTQ legislature, anti-racism, voting. We've seen the power of youth activism, and through that we can expand the network of youth educators who can provide a shared message and support young people in a meaningful way that adults may not be able to do. And to sort of speak about what we can do for youth, our overall message to them, I'd like to touch on my experience working with youth on the crisis lines of Kids Helpline, and mention that our main goals beyond assuring their safety and assessing their risk of imminent harm is to make the youth feel empowered and to encourage them in any capacity that we can. So something that you asked, what's something you could say to them? Something that I would like to say is that to the youth is that they are valued and that they are cared about. And that's something that I say directly to them when I'm talking to them, because I think it's such an important basis for the trajectory of the conversation, or perhaps the decisions that they will make after our interaction is over, to make sure that they know that they're valued and heard. So something that I've experienced as in this role is to get feedback from the texters. And I've had people thank me for listening to them and their pain, and for valuing what they have to say. And some people even told me that they weren't sure what they would have done had they not reached out. So yeah, I'd say that my ultimate message would be that of encouragement, for sure.
Yes. Yeah, that's the reason. Our main principle in what we're doing is empowerment of the next generation, and but they need also the appropriate tools, right? So if you have a crisis line with no place to send people to, that is not much of encouragement. Or if you know that the housing situations are more kids are street entrenched because they can't really find a proper and independent living, and their parents don't want them anymore, or they don't want to stay home, it's also not much of an encouragement. So it's also about to create the opportunities, so yeah, so I hear that also the drug use, the healthcare situation, the housing. So it's much more than just let's say a limited problem. It's more let's say as a crossroad. It's really something where everything is culminating. Jenny, what should be the message also decision makers are sending to the next generation, to the next level of experts? So how to bring this this constructive spin into the discussion, as Raha described it?
Yeah, thank you for that. And I just want to touch on the issue, the last point that was made. You know, when people are in a crisis, at that heightened point of crisis, and they're trying to reach out for help, and even if they do, I'll tell you, with experience through my own network, I have had a situation where a young person that I'm aware of was in a crisis situation, and you kind of sense it. You don't know for sure. They didn't say exactly, but out of that sort of sixth sense feeling, you checked into it and the person was in fact in crisis, and luckily there was intervention. Now, afterwards, helping the person sort of connect up with organizations through the crisis line. I'll tell you, phoning the crisis line for the young person was not an easy task. They phoned and could not get through as one. So anyway, through that separate process, because intervention was sought, but what was really critical needed was other elements to support the young person through that process, including housing options, and there was none. Right. And so consequently, you erode the trust when you reach out and you're trying to do this and they think that they could get help, but all the help that they were seeking was not materializing. And so if it's not matching what their hopes are and what their needs are, and then you can actually have a situation where it backfires. So from a political point of view, from my point of view, for me, it's about fighting for resources too, in allocation with that commitment, political commitment to put the resources in place, and for the people on the ground and through processes to bring the services together. I'll tell you, in British Columbia, as an example, I just visited Covenant House not very long ago, and they're oversubscribed in terms of beds. And in British Columbia, 15% of the people who are unhoused, who are homeless, are young people. How is this even possible? And if you look at our budget, for example, and there's no dedicated funding for youth, in terms of housing, in terms of support services in that regard. So I think that on the question around trust and what is the message, A, is that we have to trust and believe in the young people. Their voice matters. Their experiences are real. They actually know best in some cases, right? And we need to reflect that in the solution, in the decision making, which is why I say, when I was thinking about this panel, what would I say? And what is the most important thing? Allowing for young people's voices to be heard, facilitating for the processes for them to be heard, go out of your way to make sure that they are at the table, and where that decision-making actually is meaningful and will yield an outcome. So it's not an exercise of pretense. Otherwise you will erode any trust that might have been built in that process. And I think that's for me is really critical, and is a commitment, is a political commitment of dedicating resources to that. And right now, I'm sorry to say, we haven't really seen it. We haven't seen it, with the levels of government, and that resource needs to be put in place. And then empowering, I think, organizations on the ground who's doing the work too, right? The frontline workers, the people on the ground who's doing the work, and also making sure that they're provided the training so that they're youth-informed, trauma-informed, for example, in doing that work. And oftentimes we put training off to the side. We just don't think is that important in a time when there's not enough resources. And then I think we gapped opportunities. Outreach is key. There's no question. Making the connection is absolutely key. And I think education as well, putting resources in education and bringing family members who are also struggling along, family members who don't know what to do. And oftentimes they think the only way is this way. There's lots of things to unpack within the family dynamic, and that needs to be dealt with. And so therefore putting resources in counseling and support is really central. The last piece I'll leave with you with that too, and I think government need to resource this as well, and particularly having it to be culturally sensitive to the situation and to the individual and their family's needs would be key. In the instance that I was engaged in, at the end, I was able to actually help the young person connect with an elder, an Indigenous elder, to make that connection, to help to build the resource for the individual to bridge them forward in a culturally sensitive way. And I think that needs to be properly resourced as well.
Mm-hmm. Roberto, what would you see? What would you like to build, or what would you like to see looking from an expert or let's say a professional adolescent psychiatrist, what is it? What's missing? What would be a good tool to build or to create in order to make that happen?
So I see a lot of different things, and absolutely agree that we have to show with our actions that we value the youth. I mean, it's not only giving the message, but actually doing the deeds and doing the work. And it might feel sacrilegious for a physician or health authority to advocate for money to go to different institutions. But I agree with Jenny Kwan that there's very good data showing that if we want to prevent complicated substance use, the investment has to be done in schools. It has to be done with parents. I'm sure that many people here in the audience are familiar with the Icelandic model, where, even though it's a country that is quite different from ours, they managed to decrease substance use in young people quite dramatically over the last 10 to 15 years with investment in two things. One was schools, to make the days at school longer with the fun activities, with the sports and theater and music and so on. So keeping the kids at school and engaged with things that they're excited about. And the second thing was parenting support, was counseling. And by just doing that, and not looking at this from the medical perspective model, not even talking about substance use, they were able to decrease substance use quite dramatically in Iceland. So I think that we can learn from the other jurisdictions that there's very good evidence showing that some of the basic elements and at school and at home should be put in place for us to prevent more problems down the road.
And Jenny, I know you know Shiway also quite well from downtown East Side. That is also an example I like to quote, where with a good mixed interdisciplinary approach, with not so much money invested, actually, you could turn around the foster care numbers from 80% of the kids going into foster care and the families destroyed, and certainly most of the mothers going back to the street, and to 20%. So you create a system which is really addressing both needs, the needs of the parents and the needs of the kids, and you achieve an immediate kind of turnaround of event. Unfortunately, that is probably not always the case, but it's a very encouraging example how healthcare, social support, integration of care could be very successful with the most vulnerable population we see. Marisha, you have questions from the audience? Okay, I go then here right away. Okay, question answer is nothing.
I can read them out for you if that's easier. Michael.
Yeah, read it out.
Okay, great. So the first question we have is, has there been work done in Canada or elsewhere to target the illicit fentanyl supply as a primary prevention strategy?
I think no, and this is never a very successful strategy, because only 10% of the import, or even fentanyl right now, is produced in Canada. So it's what is imported are the precursors, and that was never successful over the last 30, 40 years. So if you are only able to collect 10% of the supply which is going into Canada. Okay, next question.
Thanks, Michael. Next question is, any suggestions or thoughts on what the government can do to address silos at the ministry or sector level that present barriers to integrated healthcare?
Who wants to pick this one?
Maybe I'll jump into this one a little bit, seeing it's about government and its operations. I have to tell you, in my experience at all levels of government, the issue around silos between government within ministries is shocking and is so pervasive and entrenched. The only way, in my view, that you can really get through it is to have really at the very top of the government's food chain, so to speak. So in the federal government, it would be the Prime Minister and the Prime Minister's office, who comes forward and state very clearly that my expectation, and then the mandate letters to each of those ministers or ministries involved, that they're given an edict, basically, that they need to work across government to achieve specific outcomes and goals, and to break down the bureaucracy. And then even if you put it in the mandate letter, you have to follow through. You have to have a champion within government, within cabinet, who will be driving this agenda through and to bring it forward. I'll tell you, at the provincial level, when back in the day, when I was a minister and we were trying to bring forward the first safe injection site to British Columbia in downtown East Side, there was a huge resistance, even though I was given the political authority to go and get this work done. I took the time just, to bring the bureaucracy on board. I told my deputy that I want to meet with all of the staff. And I want to tell them, this is why I want to achieve this, why this is important, and answer their questions. I need the bureaucracy to be working with me to make this happen. And I spent countless hours, I don't know how many meetings I went to with staff to sort of go through this work and to tell them the importance of it. And then afterwards, I had my deputy meet weekly across department deputies about their work and directors about this work and what is being achieved, what is the roadblock, what do we need to do to try to achieve the outcome. It was endless, to the point where my deputy said, like, Jenny, do I really need to do this? And I said, yes. I don't care what happens at these meetings. If you got nothing to report back, you still need to do it, because I want to have outcomes. I want to know what the problems are. How do we bring the cross ministries on board to get this outcome? So it is an arduous process, I will say that, but you have to do it with a concerted effort, with due diligence and persistence. Otherwise, it won't get done. I'm sorry to say, it just won't get done. And that needs to happen across levels of government as well, because after you break down the silos within the same level of government between ministries, then you need to break it down between levels of government. So, and then from there, you need to bring it back to the community, because it has to be community driven. And so you have to have that buy-in all the way around, and that good communication all around the tables. And, even then you experience barriers and setbacks, but without that kind of effort, I just don't believe that it will get done. I haven't seen it in my 30 years in elected office. And the only time you can break down these barriers is to really be laser focused about bringing communities together, ministries together, and really punching a hole in the bureaucracy.
And it's also more, the point is, it is achieving better outcomes. If you overcome silos, you can create a continuum. You can do things much easier. We just talked about educational system, healthcare system, housing, and all of that. So if that is kind of hand in glove, and if it's really integrated, then things are cheaper and more effective. There is one more question from the audience, and then unfortunately it's time to wrap up.
So the question is, how do families get more support to better support their youth? Most of the time, the family has to be kind of involved in the process or treated at the same time as youth. Some examples could include things like social media or education, whatever your experience is.
That was one question. Okay.
Kind of a combination of questions.
Okay, who wants to pick that up?
This is absolutely crucial. And I think that's one of the things that we should be doing better, engaging not only the voices of young people, but the voices of the caregivers and the family members. People here in BC might be familiar with the Family Smart, which tries to approach this by providing almost a peer support that the family members for young people that have gone through mental health or substance use crisis. But there's definitely more than that we should be doing.
Wonderful. Actually, again, also the example of Shiwei, because to stick with one example, it was the turning around the situation around foster care was also a good reason for the mothers to change something in their lives and appreciate having a child and taking care of it and so on and so forth. And there was also some housing support coming with that and so on and so forth. That is kind of, there are good examples to giving us hope. I would invite you, everybody, to 2 sentences summary message for the audience, and then we try to provide a nice evening for all of you. So, Raha, you want to start?
Sure. I guess if I were to pick a take-home message, it would be to kind of iterate that any intervention that reduces stigma is critical. Reducing stigma is what makes it easier for people to seek care when they need it. So having a peer that can advocate for them, like we mentioned, with peer support, or family members being willing to come to the hospital after an overdose, for example, is crucial. Because we know that there are many touch points within the healthcare system that can fundamentally change the trajectory of someone's use after a potentially life-threatening event like an overdose. So just to iterate that we cannot force people to seek care in BC, so we need to make options attractive, appealing, engaging, youth-centered, and low barrier.
Wow, that was also nearly a political program. Roberto, you want to go next?
Yes, of course. And very briefly, I would say that we need to collaborate. We need to collaborate across agencies, across government branches, with the indigenous communities, with local leaders, with healthcare providers, with youth, with lived and living experience, with family members, because that's the only way that we're going to be able to provide treatment options that are going to be more effective.
So, Jenny, the last word to you.
Well, just to add to all of that, I would say don't give up. For the families who are struggling and who are faced with this challenge, don't give up. And to know that there are many others who are also in the same struggle, and keep an open mind on what the solutions might be. There's often the case that for young people who are struggling, there are many layers to that complexity of their struggle. So keep an open mind to it and to see how you can find a path together. Don't feel like you have to do it by yourself. And the young person who's struggling, don't feel like you need to do it by yourself either. As long as I think we keep those touch points in place, there's hope. And then most important of all, from a political standpoint, from a government standpoint, politicians need to be held to account. Governments need to be held to account. And words matter, but action matters more. And that has to match.
Wow, that was kind of not anything to add to that. I really think we had, after a very complex and exhausting day, we had a very wonderful panel with a complementary perspectives, and that gives also some hope that there is a siloism, but there is not the level of speechlessness. I think I take you very serious there, in not giving up to trying to convince others, convince the other players to do something different and more productive. Thank you very much for participating in the panel.